When it comes to prostate enlargement, are you looking for the top prostate diet tips to improve your prostate health? What about supplements? Well, in this video, we're going to break it down. Hey, it's Dr. Garrett Pullman from the Prostate Health Academy, where we help you learn more about prostate conditions, connect with like-minded individuals, and improve your overall health. So if you've ever wondered what in your diet can help with prostate enlargement, what about supplements? In this video, we're going to break it down, and I'm going to share with you what we know in regards to diet and supplements for prostate enlargement. If you see value in this video, make sure to give it a thumbs up. Many men are not aware of the function of the prostate or the impact it can have on their lives. The prostate is a walnut-sized gland which is located below the bladder. The urethra, which drains urine from the bladder, actually passes through the prostate. The prostate's primary function is to produce the majority of the fluid for the male ejaculate, which helps nourish and transport sperm. BPH, also called prostate gland enlargement, is a common condition as men get older. It is a benign condition and not related to prostate cancer. The prostate usually begins to grow around the age of 40 to 50 years old. BPH is a very common condition that affects 40 million American men and over 500 million aging men across the world, including 40% of men in their 50s and over 70% of men in their 60s. Several studies have shown potential direct and indirect influences of several micronutrients and macronutrients on the risk of developing BPH. We will first focus on macronutrients. Macronutrients are the nutrients we need in larger quantities that provide us with energy. When looking at macronutrients, well, what about vegetables? Are veggies good for the prostate? In a prospective study, which looked at over 32,000 men, found that men who had a diet rich in vegetables in general were less likely to develop BPH compared to their counterparts who reported a lower consumption of vegetables. One potential explanation for this is that vegetables contain high levels of various factors, including antioxidants that may play an important role in altering inflammatory pathways associated with the development of BPH. Now, what about micronutrients? Micronutrients are often referred to as vitamins and minerals, which are vital to healthy development, disease prevention, and well-being. So nutrients with antioxidant properties or that influence cell growth and differentiation have been found to reduce the risk of BPH. Consumption of fruit and vegetables rich in beta-carotene, lutein, or vitamin C were found to have a reduced risk of having BPH. Now, beta-carotene is an antioxidant and a precursor of vitamin A. Lutein also is an antioxidant. Among foods that are rich in lutein, beta-carotene, or both include spinach, cooked and raw, Brussels sprouts, peas, and peaches. Also, the intake of vitamin C from foods, but not from supplements, was associated with decreased odds of getting BPH. One of which was looked at included increasing consumption of orange juice, which tended to have a lower risk of BPH. Now let's talk about fat. The high fat content food that you are eating may be putting you at high risk for prostate enlargement. A recent study looking at 180 men with BPH and 246 controls showed that high fat content food such as butter and margarine is associated with an increased risk of BPH. Now this may be due to the pro-inflammatory effects of a high fat diet, which results in prostate inflammation, hypoxia, and tissue remodeling. Obesity has become a global epidemic. The prevalence of obesity has doubled in 73 countries around the world and steadily increased in others since 1980. People who have obesity, compared to those with normal healthy weights, are at an increased risk for many serious conditions, including death, high blood pressure, high cholesterol, type 2 diabetes, heart disease, stroke, arthritis, gallbladder disease, sleep apnea, many types of cancer, mental illness, and body pain. Well, what does it mean to be obese? Obesity is classified by a body mass index, or BMI. A BMI of 18.5 to 24.9 is considered a healthy weight, 25 to 29.9 overweight, and 30 or higher is obese. For example, looking at someone who is 5 foot 9 inches tall, 125 to 168 pounds is a healthy weight. 169 to 202 pounds is overweight, and 203 pounds or more is considered obese. Well, why are we talking about obesity? Obesity is a risk factor for both benign prostatic hyperplasia or BPH and prostate cancer. So when looking at the evidence for obesity and prostate enlargement in a prospective study of more than 18,000 men without prostate symptoms at baseline, men with a higher BMI as well as higher total and abdominal fat were more likely to develop bothersome symptoms of an enlarged prostate. These men were also more likely to experience progressive worsening of their urinary symptoms. Now, there are several reasons hypothesized for the role of obesity with BPH. Men who are obese have been shown in several studies to have larger prostates. Obese men have an increased estrogen to testosterone ratio given conversion of testosterone to estrogen in fat tissue, which may play a role in prostate tissue enlargement. Lastly, there is a suggestion that obesity may be linked to increased smooth muscle contraction in the prostate from increased sympathetic nervous activity, leading to worsening urinary symptoms. Now, I get a lot of questions from my patients in regards to various supplements for an enlarged prostate, and we'll definitely want to touch on that in this video. But before we do, if you're enjoying this video, I would hate for you to miss out on the advantages of becoming a member of the Prostate Health Academy. The Prostate Health Academy is an essential community for individuals wanting to dive in even deeper and learn more about the latest technology and treatments available to them for prostate conditions. In the Academy, you'll be able to interact with like-minded individuals in the private community forum and have access to exclusive bonus podcast member-only video content with experts, innovators, and leaders in the field. We'll also be keeping up with the latest evidence on prostate-healthy diet and activity and creating a roadmap to keep you on track. To learn more, just go to www.prostatehealthacademy.com and click on Join Now again. That is www.prostatehealthacademy.com and click on Join Now, and we'll see you on the inside. Okay, when we look at supplements, historically, one of the more popular BPH supplements is zinc. However, when looking at the data, there is no difference in effectiveness when comparing zinc to placebo. Some studies actually showed that high supplemental doses, either dietary zinc or zinc supplements, may actually increase the risk for BPH. Now, by far the most commonly asked about supplement from the men I see in my clinic is saw palmetto. By far the most commonly studied extract is that of the saw palmetto plant. Saw palmetto is a type of palm native to the southeastern United States. The berries of the plant are commonly used in supplements sold and touted to improve prostate health, balance hormone levels, and prevent hair loss. Early evidence suggested that saw palmetto may have some efficacy in the treatment of symptoms of BPH. However, more recent studies with more rigorous methods have failed to confirm a clinically important role for saw palmetto in the management of BPH at this point. Further clinical trials, which are ongoing, will determine if saw palmetto has any value or not in the management of men with BPH. Well, that concludes our video on the effect of diet and supplements with prostate enlargement. Make sure to give us a thumbs up, and if you're ready to take the next step towards improving your prostate health, would hate for you to miss out on the opportunity to join the Prostate Health Academy. We'll see you on the inside.